Hamstring strains. Very easy for the patient to recognize. They happen abruptly. They happen during that stance phase of gait, usually while sprinting. It's described as a tearing sensation. It's uncomfortable. It hurts. Normally, you're going to see that in the mid-substance all the way up to the ischial tuberosity. It's painful, and it often is bruises. That bruising is sometimes concerning to the patient. Keep in mind when you have bruising in that area, it's going to start off as red, it's going to start to migrate to purple, it's going to move into blue, black, and then eventually green and orange. That's a change in hemoglobin, and it's also going to start to migrate down the leg due to gravity. That's common. How do we recognize this condition though? How can we be certain it's more of a muscle condition versus a nerve issue? I love the straight leg raise and throwing in Braggart's test. Can I have you go on your back, please? What you can do with these patients is you can move that leg and stretch the hamstring up into that straight leg raise. Eventually, it's going to cause some pain at that ischial tuberosity. But what is it? Is it a muscle or is it a nerve? Is it sciatica or ischiofemoral impingement, or is it a hamstring issue? So you can use Braggart's test to differentiate that. If they have reproduction or pain at the ischial tuberosity, and you throw in some ankle dorsiflexion, which will not affect that area. When you're doing that, you're affecting the gastroc and soleus. If you get reproduction of symptoms upon Braggart's test, that's not a hamstring issue. We're not affecting the biceps femoris with that test. So if you can do that and you can increase symptoms there, it's probably a nerve issue. However, if you do Braggart's test and it does not change symptoms at the ischial tuberosity or within the hamstring, then we can be certain it's more of a hamstring issue. Now, what can we do with these patients? Fortunately, we can use one test or one exercise not only to treat it, but also to prevent re-injury. And that's going to be on the mind of your patient. They want to get back to their sport. And if they have this recurring injury, it's going to be on their mind. They're going to run differently, they're move differently, they're not going to sprint to get that ball. So one test that we can use is the Nordic Exercise. It's an eccentric strengthening, a progressive loading program for that muscle. What I'm going to have the patient do is kneel with your feet off the side here. With holding her feet down, I'm going to have her keep her ear, her shoulder, her hip, and also her knee all in line. She's going to slowly go down, and as she does that, she's going to progressively load that hamstring, and then once she reaches the bottom, she's going to catch herself and slowly come back up. So what I'm going to have you do is slowly go down as far as you can, keep going, and then drop down. And then she's going to walk herself back up, and she's going to do the exact same thing, and slow, and then catch herself. You can stay right there. Progressive loading programs. You're going to start small. Maybe it's just 1 to 2 sets of 6 to 8 repetitions. There's a great journal in the British Journal of Sports Medicine that says for maintenance, to prevent this from happening again, we can just do this once a week, 3 sets of 8 repetitions. However, when they're in the injury phase, after you get things to calm down, after they're running about 50% of their speed, you can start this process. I would start off with 1 set of 10, and I would work up to 3 sets of 10 repetitions twice per day to get that muscle tendon junction working properly and get them back to their sport. If you want the evaluation, the treatment, and also the rehabilitation exercise to give to your patients, check out Chiro Up. The condition reference is where you're going to learn about the condition and all the up-to-date research, and the condition report is how you're going to deliver everything that you know about that condition and give it to your patients. Check it out.